start medical school, there's always pressure that you're going to become a cardiologist or a surgeon, something like that.
I actually didn't start in public health. I started in radiology.
Like many public health physicians, I've had quite a circuitous route.
There's no way I could have mapped out my career path ahead of time.
How did I get to be what I'm doing now? On a long sort of serendipitous path of following a variety of interests.
My career sort of meandered, as probably many people did. I started off as a family physician, worked for 3 years in a family practice in Toronto, and kind of knew that intuitively that wasn't for me, but wasn't quite sure what was for me.
I had started out in family medicine, the intent to work in Africa and other places internationally, and while I was in my residency program, I just found so many things that didn't have to be, and that were easily, I thought, preventable.
And over time, irritation built about seeing end products of disease, communicable, infectious, injury, just preventable across the board.
There was nothing that happened when I finished my training that told me I'd end up here. Opportunities came up and I took them.
I first got interested in public health, I would say it would be twofold. I've always been passionate about social justice issues and health policy. So I first became aware of the specialty when I was, in fact, an undergraduate student at McMaster University. And I confirmed my decision when I was probably in third year, when I started my clerkship rotations. My very first clerkship rotation was internal medicine. And that's when I realized there's more to illness. And every patient I saw, I was always more curious about their history. I don't think my attendings really appreciated that, but I always inquired about their lives and what was going on in their lives, and if that was contributing to their illness, to their disease.
I was on psychiatry at the time and working with a young single mom, two little kids. She was suicidal, attempted suicide, and I worked with her over a month to the point where she was no longer suicidal. But she had very little education, very few friends, no supportive family, didn't have a job, trying to raise these two little kids, and quite honestly, she had every reason to be depressed. I mean, we really, if we want to get at people's health, we actually have to be able to address what we've now come to call the social determinants. And so I decided at that point to do a residency in preventive medicine.
A colleague now who at the time said, "Oh, I'm here for a year. I'm just doing this work in this clinic until I can start a residency in public health." And I said, "Oh, what's that?" I didn't even know that public health existed as a specialty. Always been really interested in prevention. Everything I'd read was about prevention. I was always fascinated by vaccines and communicable diseases, and so explored the opportunities and applied for the residency.
As a medical student, I was often in the position finding myself asking what could have prevented this, or what was the bigger picture in terms of the acute issues we were dealing with on a patient-to-patient basis. And so upon learning of the specialty of public health and preventive medicine, I think it became a really clear path for me. So it combines the ability to have the short-term gratification of solving health problems with the long-range planning aspect of preventing things and looking upstream.
Okay. The reason that I chose to go into public health is that I was very interested in the larger picture, and not only considering an individual's illness or state of wellness, but also looking at larger groups, larger populations, looking at why certain groups are affected more than others, and trying to look at ways to eliminate these differences between groups and their health statuses.
Just the potential impact that we can have on large numbers of people. Clinical medicine is really important, but seeing the problems one at a time and knowing that there were these sort of social conditions that were creating these problems.
Donc, pourquoi je suis allée en santé publique? Premièrement, juste pour dire que j'ai découvert la santé publique assez tard. Quand j'étais étudiante en médecine, je ne savais pas que ça existait. Mais quand j'ai découvert la santé publique, j'ai été vraiment heureuse parce que j'ai découvert que c'était ça ma voie, parce que ça combinait ce que j'aimais de la médecine, surtout le désir qu'on a tous d'aider les gens. Puis, ça combinait aussi mon ancienne passion qui est peut-être plus les sciences analytiques, les mathématiques.
the rest is really mostly a history of working in different settings as a medical officer of health, rural, northern, and Manitoba, then Winnipeg for several years, and then as the provincial chief public health officer for 12 years until 2012. I always had a foot in the medical college at the University of Manitoba, and mostly doing teaching, mostly of undergraduate students in public health, and some graduate teaching. And now I'm also directing the Master of Public Health program and have taken on some roles like that. A little bit of collaborative research, but and a little bit of private consulting from time to time. And one foot in emergency medicine and urgent care until 3 years ago, just sort of trying to get in there once a week for a shift just to stay honest and be in touch with the real world of medical practice.
So your question is, what is my role in public health, and how did I get here? I had some clinical experience, which I think is very important. Most important was in the Canadian Arctic many years ago, and then I went back to the United Kingdom, trained in public health, and but concentrated on infectious diseases, and then came to Canada and worked at the local level in Saskatchewan, and then at the federal level for a number of years in Health Canada, Public Health Agency, and then in the World Health Organization.
Vous m'avez demandé ce que je fais en santé publique, puis comment je suis arrivée là. Alors, je suis arrivée en santé publique après 2 ans de spécialité en pédiatrie et un bac en sociologie. Alors, c'est un parcours qui était un peu atypique, mais qui m'a très bien préparée à la carrière. Dans le moment, je suis médecin conseil en santé publique dans une direction de santé publique régionale et j'ai une journée par semaine où je travaille avec l'Institut national de santé publique du Québec dans un rôle de soutien au développement des communautés. C'est mon activité de loisir, mais c'est aussi l'activité qui me garde un sourire et qui donne l'énergie pour les autres actions.
What is my role in public health? I'm the Provincial Health Officer for the province of BC. That position was established in the Health Act in 1994, when the government of the day took on a review of health services in BC and determined that they needed an independent voice who could monitor the health of the population, who could make reports to the Minister of Health on the health of the population, and could give advice on policies, programs, etc., that would be geared towards improving the health of the population and should have an independent voice to speak out on health issues. Most of those problems could have been avoided if people actually had access to information, the ability to make decisions that were informed, or could access healthcare services on a preventive, proactive basis, which got me deciding that I needed to learn more about the skills available in community medicine, the epidemiology, communicable disease control, health system management, etc.
So my role in public health, well, I work in environmental public health as a medical health officer with a health region in Saskatchewan. And so there's 2 aspects to that. There's I guess a very reactive piece in terms of traditional health protection. We're often responding to things like potentially foodborne or waterborne outbreaks, as well as other environmental incidents that could harm health acutely. As well as that, there's a long-term planning piece, and that we're trying to look at the broader environment. So whether it's the air and water, or looking at things like the built environment and how that can produce health-promoting conditions.
I'm a full-time consultant to public health organizations across the country at the national level, provincial, territorial, and local. Occasionally I also do work for public health associations and NGOs as well as academic institutions. And the nature of the work is dependent upon what the problem is I'm being asked to solve. I mean, typically my clients are colleagues, other public health physicians working for these organizations, occasionally not, who are looking for advice. Typically my projects fall into 3 main categories. One would be issues around workforce development, and so I've been very involved in identifying the competencies needed for public health practice, for how best to design and deliver MPH graduate programs, that kind of thing. Another big chunk of work is the structure and design of public health organizations and systems, where provinces, for example, have asked me to come in and review the design of public health in their jurisdiction and ask for advice as to how they can improve how public health functions for the betterment of the people of that province or territory. And then the third category would be actual content issues in public health, where an organization will ask me to look at an issue, review the evidence, and provide them advice for their context as to how best to deal with it. So, for example, one of my clients is a large municipality, and they're wanting to do more work in the built environment to create a more supportive environment for healthy living for citizens.
I first did a deputy medical health officer position in Saskatoon Health Region. What I'm currently working as in public health is a medical health officer for Fraser Health Authority. And I'm fairly recent in my career. I'm approximately 2 years out of my Royal College final year.
It's a profession where I found a lot of people who really shared my values of social justice.
I don't think there's any other branch of medicine where you can have the potential to do as much.